Good evening. Welcome to the Pearl Report. I'm Diana Lin. Tang Kwai-si had hepatitis B. She suffered acute liver failure after doctors gave her a high dose of steroids without prescribing an antiviral drug. She died despite having 2 separate liver transplants. Hepatitis B is indeed a time bomb. So if you know you have hepatitis B, what should you do? Lorry driver Cheung Wing-cheung has 2 children. His younger son attends primary school. Cheung's recovering from a serious illness. He had to stop working to rest at home. He says he is seldom sick, so he never had a health checkup. 2 months ago, his wife saw his eyes had turned yellow, his feet and belly swollen. She forced him to see a doctor in the hospital. He was diagnosed with serious liver cirrhosis and transferred to Queen Mary Hospital.
It seemed I had no health problem. Like when the doctor checked me, he repeatedly asked, "Is it painful here, there?" I didn't feel anything. For instance, the liver. Others are this big. Mine has hardened to a small piece. For steamed ribs, use less soy sauce. Just boil vegetables with only a couple drops of oil. We used to add oil and meat. Now we don't even put in meat.
After Cheung was admitted to Queen Mary, he was prepped for a liver transplant and given numerous checkups.
Bone marrow extraction was done promptly. When I was in pain, I thought of my 2 kids. When no one was around, my thoughts brought tears to my eyes because I was really afraid. What will happen to them? They're too young and still at school. Who will raise them?
His wife stopped working for a while to take care of him. She just recently returned to work. In the week her husband's illness was most critical, she decided to donate her liver to save him. Luckily, Cheung's condition slowly improved after taking antiviral meds and didn't need a liver transplant. Mrs. Cheung says she very much regrets not telling her husband to do body checkups.
When he was in critical condition in the hospital, I blamed him for not seeing a doctor and blamed myself for not forcing him to do so. I'm so afraid he will pass away.
A recent Hong Kong University survey found nearly 8% of Hong Kong's population has the hepatitis B virus. Most were born before 1988 and were not vaccinated as babies. 1 in 4 people with hepatitis B virus but don't undergo tracking tests or treatment will develop liver cancer or cirrhosis.
People actually know their hepatitis B cases and they still don't realize firstly that they are treatment. Secondly, whether they require treatment or not, they should still check. The risk of a hepatitis B carrier developing liver cancer is up to 100 to 300 times more common than a non-carrier.
Lai Ching-lung, head of the Hong Kong Hepatitis B Free Foundation, does research on treating hepatitis B. People usually think liver cancer is caused by excessive consumption of alcohol, but most of Hong Kong's liver cancer patients have hepatitis B, which is hard to detect.
There are absolutely no symptoms. Even with liver cancer, no symptoms until a very, very late stage. The main reason is the liver has no nerve fibers. So only in the rare condition when the liver is markedly distended, there may be some discomfort.
In the 1990s, from a lack of drugs to control hepatitis B to the emergence of antiviral meds, Dr. Lai says the problem rests with many people being oblivious they carried the virus and thus never sought treatment.
It has been proven that if you take these antiviral agents, that it can decrease the liver cancer rate, and also if the patient has got cirrhosis, it can be reversed. A lot of Chinese patients do die of liver cancers.
Hepatitis B is a nemesis of Asians. About 70% of virus carriers live in Asia. The virus can be spread by body fluids. A mother with hepatitis B can pass it on to her child. It's estimated 70 to 90 million mainlanders have hepatitis B, 30% of sufferers worldwide. In 1998, Hong Kong began vaccinating babies, reducing the viral infection rate from 10% to 7 to 8%, or about 500,000 sufferers. In 1986, Taiwan started vaccinating all babies and lowered the infection rate from 1 in 5 or 6 people to 1 in 10.
Hong Kong is similar to Taiwan. In Taiwan, half of the infected people had the virus passed down from the mother at birth. That's how we are similar to Hong Kong. We vaccinate newborn babies. This leaves a problem with the hordes of people in the Asia-Pacific region who are already infected with the hepatitis B virus. Vaccination is useless to them.
Chan says a general census must be taken to ferret out virus carriers and treat them to reduce the chance of developing full-blown diseases.
Worldwide, over half of those who died from hepatitis B-induced liver cancer or cirrhosis are Chinese. The annoying thing about hepatitis B is you have no symptoms. When symptoms do appear, it's too late. That's why screening is needed.
Dasha District, Kaohsiung City, Taiwan. On this day, residents gather at a community hall where an NGO is checking for hepatitis B for free. The activity starts at 8 a.m., but people turn up half an hour before to have their blood samples taken.
Because villagers wake up early, 4 or 5 a.m. When we go to the Alishan mountain area, we have to start at 5 a.m. People say saving a life is ascending a 7-story pagoda. Don't know how many turns I've climbed.
They've done about 600 screenings in remote villages, serving over 500,000 people. On this day, 100 volunteers chipped in.
Fill in forms here. Because many villages are illiterate, we need many volunteers to help.
After filling in forms, blood samples are taken and put into a centrifuge right away to preserve the blood.
They won't come just to have their blood samples taken. We have a lucky draw and free gifts. Today is noodles, wish everyone longevity.
I got the leaflets and wanted to come because it's very convenient. It's nearby. There's a lucky draw. It's fun, joyful. See how popular it is.
In the villages, people might never have done blood sampling and ultrasound. So we have to abolish this dead end for hepatitis B. We have to go to these dead ends, see where the blind spot is.
Besides the NGO's sallies, the Taiwan government is also offering free hepatitis B checkups for citizens aged 45 and above.
Because it's a national disease, so our primary and middle school textbooks also tell everyone to go get screened. The government wants people to go to hospitals. NGOs are taking the initiative to go to communities. I feel this two-pronged approach can reach different people.
Governments can do a large-scale general census to garner accurate data. Hong Kong's health department figures on hepatitis B sufferers are taken from a census in 2001. The latest numbers are from a Hong Kong U census.
Most of the people think that they don't have hepatitis B disease because they have no symptoms. Even I have hepatitis B, there's no treatment at all. The awareness is actually very low.
Hong Kong University's community census involved 10,000 people.
Raising funds was difficult. Blood testing is costly. We looked everywhere for charity groups to show our plans. We spent 2 years amassing our first pot of gold.
With the money and help from NGOs, Hong Kong U began the census in 2015. It took another 2 years to find 700 hepatitis B virus carriers. Professor Yun Man Fung, head of Queen Mary Hospital's Gastroenterology and Hepatology Division, says conducting a general census is easier in Hong Kong due to its concentrated population.
Checking hepatitis B infection is as simple as just a click like this. Take the blood. The result will be available within a few days. In Taiwan, they do free checking on hepatitis B disease. They penetrate to different villages. If this can be done in Taiwan, I don't see why this cannot be easily done in Hong Kong.
He says Hong Kong's hepatitis B research is world-renowned, but it has problems tracking its virus carriers.
I see patients presented with a very late stage of the disease, cirrhosis, and even liver cancer. By that time, we only have very limited choice of treatment. I feel very sad, right? Because, if the patient can come to us early, we may actually salvage the patient.
How should hepatitis B sufferers be tracked and checked? More after the break. Welcome back to the Pearl Report. Nobel Peace Prize laureate and Chinese dissident Liu Xiaobo had the hepatitis B virus. He passed away soon after contracting liver cancer. Hepatitis B virus carriers might suffer from liver cancer or cirrhosis, so they should have regular checkups. We can learn from Taiwan's experience. At Mao Kong on the outskirts of Taipei, San Daojie won't ascend by cable car.
I'm the oldest cyclist at Mao Kong. Hope they'll continue. 69. Exercise is best to forget illnesses.
Son contracted liver cancer at 54. After 2 relapses and repeated surgeries, he had a liver transplant that gave him a new lease to life.
I make my own noodles. I'm on a stricter diet after the liver transplant. I treasure my new lease to life.
Son found out at 38 that he had hepatitis B. There weren't meds to control the virus. His doctor suggested a checkup every 6 months. At 54, he underwent a liver ultrasound test and found a 4-centimeter tumor. But a blood test came up negative.
So a blood test isn't 100% accurate. Blood tests and ultrasounds, if you don't do them regularly, but once in 2 years, the tumor might grow to 15 centimeters. That's late-stage liver cancer.
Son's siblings also have hepatitis B. His elder and younger brothers died from liver cancer. The younger didn't do regular ultrasound tests and died less than a year after discovering a tumor.
Liver cancer usually develops at age 40, 50, 60. This might be fatal for families. Now you say if you had come earlier, this needn't be so, right? Having a good policy can reduce the death toll from liver cancer.
In 1995, Taiwan implemented universal health insurance. People with hepatitis B can have half-yearly ultrasonographs. High-risk sufferers every 3 months.
Rich people are screened, but if you include all adults in health checkups, anybody can be checked up. Then, of course, for those with less time or money to take care of themselves, it's a greater safeguard.
At Queen Mary Hospital's liver outpatient clinic, a reminder hangs in each room for patients to get an ultrasound at a private clinic before returning to see a doctor.
你見到咧，就我哋都建議病人咧做定期嗰個超聲波啊，即係個肝臟，有冇機會做到啊？
我上嗰次做咗。
咁好啊！
點解今次冇做超聲波？
你唔記得咗。
Dr. Yun Man-fong says because there aren't resources for ultrasound tests for hepatitis B virus carriers, in recent years they are encouraged to go to private clinics, but only 2 to 3 out of 10 patients are able to do so.
If we refer all the patients to the Queen Mary Hospital to have ultrasound examination, although this is mandatory, I think they need to wait for 1 to 2 years before ultrasound can be done. We have only very limited resources in terms of the manpower, space.
This patient has hepatitis B and is male, so he's high risk. But his levels of liver enzymes, etc., haven't reached the point of needing medication. So the doctor gave him a prescription to buy his own meds. Dr. Yun says, for instance, only 1 out of 4 patients can get DNA tests for the hepatitis B virus to more accurately detect the risk of liver diseases.
Every hospital in Hong Kong, they are allocated to a fixed quota of performing the HPV DNA test. In Queen Mary, every section, we actually see more than 200 patients. We only have 8 doctors. Therefore, they need to wait for 2 hours. And then when they come to the consultation room, they only talk to the doctor in 2 to 3 minutes.
Yun estimates the public medical system covers 13% of all hepatitis B sufferers in Hong Kong. It's not known how many others do regular checkups.
Because of a manpower limitation, we only limit our quota to around 900 new cases in a year. The time of waiting has been lengthened to 1.5 years. And I would anticipate it will be further lengthened in the coming years.
早晨，大家好，早晨。我係立法會議員工聯會嘅郭偉強，亦都。
Aaron Kwok is one of over 500,000 hepatitis B sufferers in Hong Kong.
The government should actively make a campaign which can cover potential carriers. Let everyone know that they are carriers or a lot. Some carriers cannot join the regular test because there is a long wait in government hospital.
In middle school, he donated blood and found out he had hepatitis B. He's been having regular checkups at a public hospital.
When I told my family, they can't believe it. What is hepatitis B? They really think if you don't know, you don't need to do so much. I also asked my parents and my family members to have the blood test and help them to identify earlier. If I don't ask them, maybe they don't know they are also the carrier.
He spends $1,000 monthly on antiviral drugs, and before his yearly medical checkup, he books an ultrasound test at a private clinic.
If you don't pay for the prevention, then if you get liver cancer, you will spend more. The government is worth to put more resources in the prevention system rather than later to handle with the liver cancer patients for transplantation. It will lower the workload of the doctor.
Taipei City Hospital Renai branch. To streamline procedures for hepatitis B patients seeking treatment, it set up in year 2000, with government support, a liver disease center for tracking checkups for patients.
Here are many inspection rooms. Each has different ultrasound machines. The other side is the endoscope room. Many liver cirrhosis patients have endoscopy because they're prone to esophageal varices.
Dr. Chen says the center reminds patients who've missed their checkups.
Liver cirrhosis and cancer patients face costly treatments. You have to be disciplined with tracking checkups to prevent the diseases. For these people who do tracking, we can find tumors when they are still very small, tumors of 2 or 1 centimeter.
Taiwan spends the equivalent of $900 million to prevent hepatitis B. A local doctor notes Hong Kong can learn from Taiwan's experience.
Hong Kong should have a liver center in some hospital 10 years ago. And if they think the patients are very stable, they actually can make referral to a general practitioner, and they can concentrate their time and effort in managing patients who are having higher risk.
A report on hepatitis B policy issued this June compared 13 Asia-Pacific regions. Hong Kong is said to lack an official strategy to prevent hepatitis B. It doesn't have an official number of patients or forecast of prevention costs.
Other governments always have a strategy to the hepatitis B carrier, but in Hong Kong, the government only introduced the vaccination in 1989. No further treatment. We have enough capacity to do test scheme, consultation, and also to provide medicine to those carriers.
The World Health Organization proposes by 2030 to reduce the number of new cases of viral hepatitis B by 90% and deaths from hepatitis B by 65%.
Actually, it's a big challenge for the Asia-Pacific region. I think it won't be easy. We in Taiwan hope to better this time frame. We have some plans. As more of a city, it should be relatively easy for Hong Kong to do if the government has the will to do it.
Some doctors estimate the $1 million cost of one liver transplant can buy 15 patients 20 years of medicine. If hepatitis B sufferers don't track their disease and don't take meds, a number of them would contract liver cancer or cirrhosis. The cost would rise to several $1 million. Has the Hong Kong government taken that into account? Well, thank you for watching our show. It will be re-aired on Monday, Tuesday, and Saturday, as well as online and on mobile apps. Until next time, from the Pearl Report team, good night, good luck, and good health.